So this was a study of this Wee1 inhibitor called adavosertib in uterine serous cancers. Uterine serous cancers are a very or less common form of uterine cancer. They're molecularly probably distinct from what we think of as our most common types of uterine cancer. And they had certain features that made us think that a drug like adavosertib that did Wee1 inhibition could be particularly effective in them. They have p53 mutations, so they already have some cell cycle dysregulation. And then on top of that, they have a fair bit of oncogenes, so they have a fair bit of oncogenically driven replication stress. We hypothesized that, as well as other sort of markers of cell cycle dysregulation like cyclin E amplification or RB1 loss. So we thought these were tumors that could be very sensitive to Wee1 inhibition. These are cancers in which we have limited therapies. So we use carboplatin and paclitaxel as our frontline therapy, and most recently pembrolizumab and lenvatinib was approved for MSS uterine cancers, and actually in the reports from Vicky Macker and her colleagues has had quite a bit of activity in uterine serous cancer subtypes as well, which is exciting to see. But beyond that, we don't have great therapies. The activity of chemotherapy beyond that in uterine serous cancers is often estimated to be maybe 15% at highest. And so we really need alternative strategies. We were very excited about the results of this study. I think that we still have a lot of work to do, but seeing an almost 30% response rate with some very durable responses, patients on for over a year and a median duration of response of 9 months or so, is, I think, really something that says that this drug and this attacking this pathway holds promise in this cancer subtype. So we're excited to move this forward. I think that we do have work to do. We want to validate these results in a broader setting. We want to look for a biomarker that really helps us understand which are the cancers that are most likely to respond. And I think that, we also wanted to explore it in other types of uterine cancers that share similar profiles. So we actually have an exploratory cohort in uterine carcinosarcomas, which again have these p53 mutations and often again have a similar molecular profile of oncogenic stress and cell cycle dysregulation.